need to tell you something that has been weighing on my mind for a long time. I know that the moment I say this out loud, some might disagree with me. No, after decades of observing what happens to people when they try to follow every single medical recommendation that comes their way, I realized I can no longer stay silent. And here is a truth that is rarely discussed. Sometimes, the most unwise thing you can do for your well-being is to agree to endless tests and screenings, especially once you reach the age of 60 or 65. Now, I can already hear you asking, wait a minute, aren't we told constantly that prevention is everything, that we must find a problem before it becomes serious? Yes, that is exactly what we have been taught. But what if I told you that this message leaves out the most critical part of the story? The part that begins right after you find something. This is what they don't mention in the advertisements for health screenings. Once a tiny irregularity is discovered, even something that would never have bothered you in your entire life, a machine starts turning. And often, that machine starts to grind away at your quality of life. Today, I want to walk you through 4 specific tests that, in my experience, often cause more anxiety than actual benefit for people over 60. I'm not sharing this to discourage you from taking care of yourself. I'm doing this because I want you to truly understand what you are signing up for before you say yes to the next referral. Before we get to the list, you need to understand a phenomenon that completely changed the way I look at health. I call it the Cascade Effect. Imagine you go in for a screening while feeling perfectly fine. The test shows something minor, a tiny spot, a shadow, or a number that is just slightly outside the standard range. This thing might have been there for 20 years, and it would likely stay there for another 20 without ever causing a symptom. But now that it has been seen, it cannot be ignored. The thought of, what if it's serious, takes over. You are sent to a specialist, who orders a more complex scan, which leads to a biopsy or an invasive procedure. Each step carries its own risks, stress, lost time, and potential complications. And the most heartbreaking part? In 9 out of 10 cases, you eventually find out it was absolutely harmless. But by then, you've endured months of worry and physical strain. That is the cascade, and it all starts with one unnecessary test. The first type of screening I want to warn you about sounds very modern and appealing. I'm talking about whole body scans. Those full body MRIs or CT scans that promise to check everything from head to toe. The idea of having total control over your health is very tempting. But let's look at the reality. Imagine you are 65, active, and feeling great. You decide to get one of these scans, just to be sure. The report comes back mentioning a tiny nodule in your lung, no bigger than a pencil eraser, or a small cyst on your kidney. The report then suggests follow-up imaging in 3 months. From that moment on, your peace of mind is gone. Every time you take a deep breath, you think about that nodule. You return for more scans. You see specialists, and suddenly, you're being prepared for a biopsy under anesthesia. This is a significant procedure with real risks. Research shows that when we scan healthy people over 60, we find something in about 90 to 95% of them. We call these incidental findings. They are just part of having a body that has lived a full life for 6 or 7 decades. They are like wrinkles, but on the inside. However, once they are found, it is very hard to stop the cascade. Statistics show that people who undergo these general scans don't live longer. They just experience much higher levels of anxiety and unnecessary medical interventions. So, what do I recommend instead? Focus on how your body actually functions, rather than what a picture shows. Can you walk up 2 flights of stairs without feeling out of breath? Can you stand up from a chair easily? How is your balance and your sleep? These functional signs tell us much more about your true health than any random scan. If you want to truly invest in your well-being, Spend time with someone who will look at your daily habits, your nutrition, and your social connections. These are the things that actually determine how vibrant and strong you feel. Now, let's move to the second test on my list, and this one touches on a fear that many of us feel as the years go by. I'm talking about getting a brain MRI for minor memory concerns. Here is a common scenario. Perhaps you're in your mid-70s, and you've noticed that occasionally you can't recall the name of a certain actor, or you walk into a room and forget why you went there. This is a natural part of life. It happens to almost everyone as we age. But sometimes family members get worried. They've heard stories about serious cognitive issues, and they feel a push for a brain scan just to check. I truly understand that fear. No one wants to feel like they are losing their independence or their sense of self. But here's what I want you to know. Getting a brain MRI for simple everyday forgetfulness is almost never helpful, and in many cases, it can be quite upsetting. Imagine sitting with a report a few days later that mentions mild cerebral changes, age-related findings, or white matter markers. These terms sound intimidating. They make it feel as if your brain is failing. However, the truth is that these findings are often completely normal for someone in their 70s. They're simply describing what a brain looks like after 7 decades of life. It's like doing a high-resolution scan of your skin and being surprised to see wrinkles or age spots. Of course they are there. That is what healthy skin looks like at 75. The problem is that these medical descriptions don't sound normal. They sound like a diagnosis. Suddenly, you might start worrying about your future every single day, even though your mind is actually doing just fine. Studies have shown that when we look at the brain scans of healthy people over 75, more than 90% of them have findings that a computer might flag as abnormal. Yet, the vast majority of these people have excellent memory and thinking skills. The image on the screen simply does not reflect the reality of their lives. I have seen people who are incredibly sharp, reading complex books and managing their own finances, whose scans looked terrible on paper. And I've seen the opposite as well. The picture doesn't tell us the whole story. So, what should you do instead? If you are concerned about your memory, there are much more effective ways to check. There are simple 10-minute functional exercises that can be done in a quiet setting. These tasks measure how your brain actually performs, like remembering a short list of words or focusing on a specific drawing. If these exercises do suggest a concern, we look for causes that can often be reversed. You would be surprised how often a memory cloud is actually caused by a reaction to a new medication, a simple lack of vitamin B12, or even something like poor sleep quality. When you address those things, the clarity often comes right back. We focus on the person and how they function in their daily life, not just a black and white image. While there are certainly times when advanced imaging is necessary for significant changes, for the everyday senior moments we all experience, a brain scan often creates a mountain of worry out of a molehill of reality. The third test on my list is something that seems very logical on the surface, but it often leads to what we talked about earlier, that unnecessary cascade of procedures. I am talking about cardiac stress tests, specifically the kind where you are asked to walk on a treadmill simply because you have reached a certain age. Here is a situation I see quite often. Perhaps you are 72 years old, and you are preparing for a routine, minor procedure, like a knee adjustment or a simple repair. The standard protocol might suggest that everyone over 70 should have a heart stress test first. So, even though you feel perfectly fine, even if you can walk a couple of miles every day without any discomfort or shortness of breath, you find yourself on that treadmill. Now, think about this for a moment. If you are already active in your daily life and you feel strong, what is that treadmill really going to tell us? Your daily life is your stress test. Every time you garden, walk the dog, or climb the stairs. You are already passing that test with flying colors. The problem is that these tests have a very high rate of false signals in older adults. This means the results might suggest a concern, when, in reality, your heart is doing its job just fine. It could be due to a medication you're taking or simply because our heart rate doesn't respond the same way it did 30 years ago. But once that test shows a finding, the medical wheels start turning. You might be scheduled for more invasive procedures where they look directly at your vessels. These steps carry real risks and can be quite stressful for the body. And very often the conclusion is that your heart looks exactly like a healthy 72-year-old heart should, perhaps with a little character and history, but nothing that needed an invasive intervention. The real downside here isn't just the procedure, it's the psychological impact. I have seen people who were confident and active suddenly become afraid to exert themselves because they've been labeled a heart patient based on a misleading test. That test, which was supposed to protect you, might end up stealing your confidence and your active lifestyle. So, what is the alternative? My advice is to trust what your body tells you every single day. That is the most accurate monitor you have. If you can perform your normal activities, walk at a good pace, and stay active without feeling unusual discomfort in your chest or excessive shortness of breath, your heart is giving you a very positive signal. Instead of a treadmill, if you want to understand your future well-being, there are much simpler tools. One example is a quick scan that measures calcium levels in the arteries. It takes only a few minutes, involves no exertion, and gives us a clear number. A low score means your risk is very low for many years to age. This kind of information guides your choices and helps you focus on healthy habits, like nutrition and movement, rather than creating a cycle of anxiety and procedures. Don't let a protocol put you on a treadmill just because of a number on your birth certificate. Pay attention to your energy, your breath, and your comfort. Your body is already giving you the answers you need. The fourth test on my list is one that can be a bit sensitive to discuss, but it is very important. I'm talking about routine colon screenings after the age of 75, especially if your previous checks have always been clear. I want to be very precise here. These screenings are a wonderful tool and have helped many people in their 50s and 60s. But as we embrace our 70s and 80s, the balance between the benefits of a test and the risks to our comfort starts to shift. You see, the goal of this specific check is to find something that might become a concern 5 or 10 years down the line. But when we are in our late 70s or 80s, we have to ask ourselves if the preparation and the procedure itself are worth it. The process can be very draining for an older body, leading to dehydration or a feeling of weakness that takes time to recover from. There is also a small but real chance of the procedure causing physical strain on the body, which becomes more likely as our tissues become more delicate with age. For someone who values their independence, a sudden complication can be a significant setback. So, what do we do instead? We shift our focus from invasive screenings to what I call smart awareness. First, listen to your body signals. If you notice persistent changes in your digestion, unusual discomfort, or a loss of energy and weight that you can't explain, then it's time to talk to your doctor, regardless of your age. Second, use the incredible power of nutrition. The best way to support your system at any age is through fiber. Including more fruits, vegetables, beans, and whole grains in your meals is a wonderful form of prevention. It supports your digestion and protects your entire body with absolutely no risk. Choosing a bowl of oatmeal or a crisp apple is a way of caring for yourself that brings only benefits. Conclusion: trusting your journey. So, there you have it. 4 common tests that can often lead to more worry than they prevent. Whole body scans that find shadows that aren't problems, brain images for normal forgetfulness, routine stress tests that lead to invasive steps, and screenings in later years that risk our immediate well-being. Do you notice the pattern? It's all about avoiding that cascade where one test leads to another until we forget the most important question. Will this actually make my life better today? In my many years of experience, I've learned that true health isn't about having a perfect lab report. It's about how you feel. It's about your ability to enjoy your family, take your walks, read your books, and live your life with joy and dignity, free from unnecessary medical interference. The goal as we get older isn't just to add years to our lives, but to add life to our years. Sometimes the healthiest thing you can do is to ask your doctor, is this test truly necessary for me right now? What are the alternatives? You are the one in charge of your journey. Not a computer, not a standard protocol, but you. The more you understand, the better decisions you can make for your own peace and happiness. If this perspective was helpful to you, please share it with a friend who might need to hear it. I invite you to join our community here for more honest conversations about living your best, most vibrant life. I would love to hear from you in the comments. Have you ever felt that a medical test caused you more stress than it solved? I read your stories and I value your wisdom. Thank you for spending this time with me. Take good care of yourself, and remember that sometimes the best path to health is simply staying active, eating well, and trusting your own body.